Our second round table plus mental health discussion was held in Newcastle at the Deafblind Hunter Centre. It was really, really amazing to see all these deafblind people there, along with their support workers and interpreters. We had incredible discussions. Some of the issues that we discussed was needing more training and guidance for Commguides and support workers, ongoing on a yearly basis. Another point we discussed was that we want DBA to continue to advocate to the NDIA that support workers are to undertake an orientation and mobility training, which is really, really important in Commguide training. Thirdly, we discussed where we can find great resources on deafblindness. There's a lot of different areas that we can receive these resources. One of them is the Hunter Deafblind project. Another one is DBIA. Also Expressions Australia, DBA, and that includes another organisation, NexSense. Everyone involved wants to make sure that they have more information about how to communicate with deafblind people. They would like there to be resources and training provided to students in nursing or emergency healthcare on how best to communicate, and just a basic knowledge of deafblindness. We also had a lot share their experiences as a deafblind person or as deafblind parents. There was a lot of different barriers that also connect with their mental health. We discussed how professional service providers and some of their opinions and views, and how they often view those with deafblindness as having an intellectual impairment as well. They don't often try to fit in with the needs of those with deafblindness. Sometimes they don't fully understand what causes deafblind people to live the way they do, or how they view the world. The Hunter Valley Hub said there was also a lot of similar barriers for deafblind people. They were expressing their need for more training for Commguides and support workers, as well as interpreters, in order for them to work in a partnership with deafblind people and to really improve their quality of life. It was really sad to see that so many have such similar experiences and such similar barriers. At the same time, it was a great opportunity for them to share their experiences and for us all to be together. It was also discussed about deafblind people and their human rights. Because of a lack of communication, their human rights are really violated because they're unable to have that access and inclusivity within the community. There's not enough information on how best to communicate with deafblind people. People really have a lack of awareness about deafblind people and what their needs really are. They don't understand their mental health. They don't understand their culture. They don't understand the best way for a deafblind person to have quality of life. So quite a lot of them have this barrier because of a lack of communication. We also discussed what is the best way to approach and talk with a deafblind person or communicate with a deafblind, whereas to have your eye gaze, the lighting, making sure that the space is accessible. This was a really important discussion. We realised that everyone needs more training in this area. DBA received a lot of great feedback from these deafblind people. These events were really valuable. This feedback will really help us to improve our resources. For example, a mental health toolkit will become available in DVD format. That will be so useful. It was a great way for us to learn a lot more about the diversity and the different needs. We are really appreciative for them sharing with us their needs and their feedback and their experiences. We've learnt so much from you all. We're looking forward to working in partnership with you all in the future, down the track, hopefully.